Your mild-mannered dentist, Dr. Dalin here, but he has X-ray eyes. Well, kind of, now that he has this magic wand. He's joining us to talk about this new thing. It's called CariVu, and it was recently introduced at one of the trade shows up in Chicago in February, and you can do all kinds of things with this without using radiation.
Right, that's the big plus of this. It's a great adjunct. It's not replacing X-rays yet, maybe in the future. But what it does is it uses an infrared light source and it transilluminates the tooth. So we actually put this in over your tooth and it'll make the tooth glow almost. And we can actually see shadows on the computer screen which shows us cracks, decay, things like that.
Yeah, here's a computer screen. We've also got video of what it looks like when you go in, and it literally illuminates the tooth so much that you can see any fissures or any cracks or decay.
Right.
Would something like this ever replace getting an X-ray?
Possibly in the future. I mean, this is a new generation. People have been trying light sources for a while, but this is the best one that we've ever seen yet. So
this is phenomenal.
It's a way to cut down radiation. It's a great adjunct to have. So if I think there's something I'm watching in your mouth and I want to compare it to something, we can bring up an X-ray, bring up the transilluminated view, and compare them side to side and see if there's decay.
Now the corporation, it's Dexis?
Dexis is the name of the company.
Now they were saying that oftentimes with this, you can see issues before an X-ray would even show them.
Yeah, sometimes when they're very small, sometimes if there's a crack, that doesn't show up on an X-ray ever. There are other usages for these. This is for patients who just don't want to have radiation. We can try to use this because there's some patients who just don't want it.
They also have this other item here that when you are having an X-ray, it basically directs the radiation to a specific area.
Right.
And that's good.
Here's our sensor, our typical sensor that we use when we do digital radiography nowadays. This is the ring that aims and helps us aim the X-ray source on here. All they've done now is come up with a different ring source, and this one is made out of material that that blocks radiation. So it limits the amount of radiation that goes through the opening here and cuts it down about another 30% to the patient. So we're already sitting with about 75% less radiation using a sensor. This adds another 30% reduction in the radiation.
That's phenomenal. You still have to wear the lead suit, though. Or
we still put it on.
Yeah,
we like lead aprons, thyroid guards, everything. We still
Sometimes
do it
I find it hard to breathe. It's so heavy.
Yeah.
Yeah, I'm just kidding. Anyway, this right here, you're one of the few who has this CariVu in St. Louis.
Yes, definitely. We were one of the first to get it in the country.
Fantastic.
When they started doing it. So when they introduced it, we tested it for them and things like that. But it's very comfortable. We can even show how it goes in and just kind of goes right over your tooth like this, and that's all you do. And you just kind of move it along. When you see an image you like, you squeeze this, it freezes it, and that's the way to do it.
Thank you very much, Doctor. Appreciate that. We're out of time.
Always
That's
good.
Amazing. The dental industry is always changing, Randy.
We're improving.